Thanks for being with us tonight. I'm Rob Nelson.
And I'm Marnie Hughes. We begin with the long-awaited roadmap from the nation's top public health agency as to how our kids can safely return to the classroom amid the pandemic.
That's right. Students, parents, and school districts have all grappled with this pandemic for nearly a year now, many being tugged between being sent home, remote learning, hybrid, or back to the classroom learning environment. But finally, guidance coming from the Centers for Disease Control, the CDC, that kids can go back to the classroom under some safety protocols. NewsNation's national political correspondent Dean Reynolds is live in our newsroom with details about the story that affects millions of American families. Dean, good evening.
Good evening, Rob. The CDC's guidelines are familiar, and many Americans have been practicing them for months already, but they provide some clarity going forward for parents, teachers, and kids.
Wearing masks, washing hands, distancing, sanitizing, contact tracing, and testing, all steps the CDC is recommending to reopen schools. Dr. Rochelle Walensky is the CDC director. She spoke with reporters on a conference call today.
CDC is not mandating that schools reopen. These recommendations simply provide schools a long-needed roadmap for how to do so safely under different levels of disease in the community.
President Biden has acknowledged that taking all of these steps will cost money for more teachers and support staff, more school buses and drivers, plus protective equipment. But the cost of keeping our children, family, and educators safe, he said, is nothing when compared with the cost of inaction. Director Walensky said the data show that less than 10% of the COVID cases in America have been among children and adolescents between the ages of 5 and 17, adding,
evidence suggests that staff-to-staff transmission is more common than transmission from student to staff, staff to student, or student to student.
As for teachers, the CDC recommends they get vaccinated as soon as possible, but that is not seen as a prerequisite for them re-entering the classroom. Not all educators agree. Otis Johnson is a professor at the Johns Hopkins University School of Health.
Teachers need to be vaccinated. They need access to the vaccine because, we can't really reopen schools if teachers are not going to be there. And teachers are leaving the profession because they're afraid of COVID, for one, but also this is a struggle, to deal with these situations and the impact on kids and their learning.
And the impact on kids is a concern, and it's why a majority of the school districts in the country are already offering some in-person learning. The CDC cited a growing body of scientific evidence today to encourage more schools to do the same. Rob?
Dean, thank you so much.